feel weak all the time. The cough, the sore throat. It comes with severe headache.
Lazy, dirty woman who finds it difficult to have a bath. If it's no headache today, it's leg pain tomorrow. If it's none of that, she'll make up something that she'll say she was weak and all that. Like, I don't get it.
But I'm not lying.
Yes, you are. And that needs to stop.
2 weeks later.
You look different. Oh, wow. So how long has it been? A week? 2 weeks?
No, 2 weeks.
Mr. John, how do you feel about getting your wife back?
I feel good. I feel great.
You mean you want your housekeeper back? Because now I'm healthy. You want me back.
So, Mrs. Beatrice, are you saying you don't want to go back?
No, I won't.
With me now, I have our clients for the day. Let's meet them. Mrs. Beatrice, Mr. John, you're both welcome to the show.
Thank you, Mom.
Thank you, Ma.
Don't look too well. Are you sure you can go through this interview?
You started this your nonsense laziness here, Abby. How long will you keep embarrassing yourself?
Mr. John, please. Please.
I face this all the time. But I'm not lying. I feel weak all the time. The cough, the sore throat. It comes with severe headache. My body aches all the time.
This sounds really serious and you do look sick. But have you been to the hospital?
Yes, Mima, we did. And that's when I started having issues with my wife. It's just a normal sickness that everyone has. Even babies. Why must our own be different? If it's no headache today, it's leg pain tomorrow. If it's none of that, she'll make up something that she'll say she was weak and all that. Like, I don't get it.
But I'm not lying.
Yes, you are. And that needs to stop. You're not the first woman that gave birth or married a husband. I want a wife, not a lazy, dirty woman who finds it difficult to have a bath.
Mr. John, please, let's watch our words, please. That's rather harsh. Mrs. Beatrice, can you tell me how all of this started?
2 years ago. A year after the birth of our son, I started feeling sick all the time. I'm tired of my body, my husband, this marriage, this kind of life. I'm only holding on because of my son. But of what use is it if I can't take care of him? But will I leave him in the hands of this wicked man who turned his back against me when I needed him the most?
Oh wow, this is really sad. But I think the way forward would be for us to go to a more advanced hospital, maybe a tertiary place where more investigations can be done, because I think that you are ill. I can tell that you don't look well, so I don't think you are pretending. Mr. John, please be patient with her. I'll take her myself to the hospital. We'll run a series of tests. Let's even investigate and see what's going on. It may be serious and it may be not, but at least let's get to the bottom of it. Okay, can we do that?
Sure.
All right. Great then. Wow. A lot of times, things are not what they seem to be. If you do not investigate, if you do not get your facts right, you may make wrong decisions that may affect a lot of people. Let's take her to the hospital and see what the doctors will say about this. We'll be right back. With me now in our guest corner, I have Dr. Ifyok Ikpe. He is a specialist obstetrician and gynecologist. He is also the head of the ONG department of Nyanya General Hospital. You're welcome, doctor.
Thank you, ma'am.
Yeah, thank you for coming. Yeah, so our case for today is rather unusual. But again, what should the person do? Especially if, you keep falling ill, you don't feel yourself. And maybe the access you have to healthcare is probably primary healthcare. What should the person do? How do you know the person that is lying and the person that is actually ill?
Okay, thank you so much for this question. Illness is a state that it can happen to anybody. And the onus lies on us to identify where in particular, how to assess the care, and the exact place to assess the appropriate care. For instance, somebody may be sick, presenting to primary health care. They have some limitations, both in the facilities, the manpower, and what they can do, and how, at the extent they can go. So for this case scenario in which the client was sick for years and not assessing care in the appropriate facility, because sometimes in Nigeria, we are very spiritual when it comes to issues as regards health.
Now my village people.
We will say, yes, that is how God is a spiritual attack. And the issue is that if the appropriate healthcare seeking behavior at the appropriate facility was done, and by the right person, I can bet you that the illness would have been detected on time. And this prolongation of staying 1 year, 2 years, 3 years without detecting the issue would have been a thing of the past. For instance, there are some illnesses that are just there. For instance, fasting blood sugar alone can just help to detect somebody that has diabetes. And it's very simple. High blood pressure is very simple, just checking it. But there are some, for instance, hepatitis B, they may not have the facility there.
To run
or
the
screening
test.
for cancer, like cervical cancer, ovarian cancer, they will not have it at the primary care level. Because all those things, for instance, liver disease, liver function, all those, they can't do that in the primary level. And that still boils down to what they have, and both the facility and the personnel. And that entails cascading. It doesn't stop at primary healthcare. Good seeking healthcare behavior, and also the health facility, they should know where their limit stops and where and how to refer. There is a channel of communication. It's a two-way system from primary to secondary, secondary to tertiary, and also there's a feedback so that the primary and secondary will know that this is the problem that the woman was facing. So this particular scenario, it may have been that yes, the primary did not have what it takes to make that diagnosis. So they will target the man, may be frustrated, going back and forth, and then not having that particular illness treated. So we'll be thinking maybe we'll now start to target to something spiritual. But if the healthcare personnel also, they have their own part to refer that patient to a higher facility. So from there, is it hepatitis? Is it liver disease? Is it screening for all those diseases that it can be done at those higher facilities. And that underscores the need for a regular medical checkup.
That's the thing.
It can't be overemphasized.
That's the thing.
And it's not just for them alone, everybody.
You know,
Nowadays,
doctor, there are some people that proudly say, I've not been to the hospital for 5 years. I've not been to the hospital for 10 years. What I do personally is for my birthday each year, a day or two before my birthday, I do a comprehensive workout, because we don't have that culture. When a Nigerian falls ill, the first thing is you go to the pharmacy and self-medicate. When you don't feel better, you go to a lab and run tests that you feel are necessary. When you try that and that doesn't work, at this time the illness would have been
far.
That's when you start going to the hospital. We have that poor culture. What do you say to that?
That is even worse with men. men who decide to stay to you when they are almost about going. That's when it's their wife that will not drag them to hospital. It's something that has to do with a total change of mindset. Some people that say, I don't visit hospital. For instance, their mindset is that once you go to hospital,
a sick person.
That you are a sick person, number one. Or two, that a doctor or a nurse will identify something that
is not there. I was not there.
So that mindset makes them not to, they just abhor hospital. And they don't know that it's even better for that illness to be identified early. Detection at an early stage is far better than when it's at an advanced stage. For instance, like cervix, cancer of the cervix. Once it's detected at an early stage, can be managed, can be cured. But once it's advanced,
that's it.
There's nothing anybody can do. We will just be telling you palliative. That is what they call palliative care.
It's already
late. We are just temporizing, waiting for you to. So, but if it was detected early, that would have been a curable, treatable condition. That is why my message is for everybody. Take it as a duty for yourself. Have a good health-seeking behavior. It doesn't stop you from, whether you are a spiritual person, that doesn't make you less of a spiritual being. Once every 6 months or once a year is something that everybody should do. Because it's not until you are sick. There's what we call well person's clinic. It's not until you are sick you now go to hospital. So it's not just for hospital. Is not just for people that are sick. It's for people to also have a regular checkup. So you will not be waiting till the illness weighs you down. That's when you will be carried to hospital, which most times in that scenario it may be late, which is not what we are praying for. So it's nice for us to have a real orientation as regards our mind. Seek care and seek care at the appropriate facility that have what it takes to take care, to diagnose it early and then give you the appropriate treatment.
Wow. Thank you so much, doctor.
Thank you.
Thank you. There you have it. A lot of times we brag about these things and we take it for granted. It's important that, like doctor has said, that we change our mindset. There's nothing wrong with going to the hospital, even when we feel well, to go and get tested, go and get checked, to avoid issues that may be irredeemable. We did have clients earlier and were able to take our client in question, Mrs. Beatrice, to the hospital. We've spoken to our doctor. Now, Mrs. Beatrice and her husband are back in the studio with us. Let's check in with them and see how they're doing. You're both welcome.
Thank you, Mima.
You look different. Oh, wow. So how long has it been? A week? 2 weeks?
No, 2 weeks.
Oh, wow. You do look different. You look good.
Thank you.
Well, you tell me, how do you feel?
I feel so different. I've never felt this way in a while. Though I'm slightly weak, my strength is still weak, but it has greatly improved. Thank you so very much, Ma.
You're welcome. I'm glad to hear that. You do look much better. Hope you've been taking your drugs religiously.
Oh, yeah, I have.
Okay. So, Mr. John, how do you feel about this, about getting your wife back?
I feel good. I feel great. I'm shocked at what the doctor said. I didn't know.
So, how do you feel about the way you handled the situation over the last 2 years?
I
Very bad. The husband I married, I'm surprised he turned out to be a monster overnight. Do you need to get to a point where my muscles will lock up? I'll find it so hard to move. And I'll beg this man I got married to help me do something as simple as boiling water for me to have my bath. He will insult me the whole night. Even our son, he doesn't touch. He doesn't do anything. All he would tell me is, get up. Even if you're feeling pain, get up and do what other women do. Perform your duties.
Sad. Well, but at least Has he been trying with helping you with your drugs since the diagnosis and recovery? Has he been supportive?
My mom does that. I'm staying in my mom's house for now where I find peace and where I'm well taken care of.
Please, Mima, please. I regret everything I said and did.
I see.
I want my wife and my son back.
You mean you want your housekeeper back? Because now I'm healthy. You want me back.
So, Mrs. Beatrice, are you saying you don't want to go back?
No, I won't. I think I need to pay more attention to my health and to my son. I've not had a husband for 2 years.
It's really sad.
Thank you.
Oh, all right. My recommendation would be that you both consider couples counseling. I'm sorry, Mrs. Beatrice, I know you've been through a lot, but remember, we have a young baby involved in this situation. And if there's a way we can work through it, as long as he's sober and remorseful now, if there's a way we can work through it in therapy and see how you can heal and forgive, so that maybe we'll have a chance that this family will come back together.
Thank you.
She's still looking upset.
Okay.
But it'll be well. It'll be well.
Thank
At
you.
least she's fine now. This will be sorted out.
Okay.
There you have it. All glory we give to God. At the end of the day, what is critical and important is that there are solutions out there. You just need to find them. A lot of times our judgment is clouded by wrong information. We go ahead and work with that, and that affects us very negatively. This is a classic example. We hope that with couples counseling, we're able to bring healing to this family. We're able to bring them back together and ensure that this never happens again. Thank you for staying with us. If you're just joining us, you've missed out on quite a bit. But you can catch all of it on our social media, or you can visit our website, www.lifelineswithmima.com. A lot of times when we make our vows during marriage, when we say better for worse, we do not understand the full implication and meaning of what it means when it's worse. Usually when a man is sick, it's easier for his wife to be by his side and nurse him through the years until he's okay. What happens when it's the woman that is sick? Why is it that most men would prefer to dump her with her family, would prefer to walk away, and will not have the patience that it takes to love her through that difficult time? It is necessary and important to know that when you love somebody, you love them in their good time and also in their bad time. From all of us here, and until we see you next time, always remember that you don't need to go through life's issues alone. You know why? Mima cares.